All right. Hello, Randy. I've invited you on today to speak about saunas because you know this area so well, and of course we're very interested in detoxification and healthy living and wellness, and saunas have been around for millennia, or changing your temperature through adaptability. So we're going to dive into all sorts of information as to how you got into wanting to learn more about saunas, using them on yourself, and some of your stories. So, welcome to this episode, and please share like what got you into looking at a sauna for a wellness product.
Well, thanks very much for inviting me.
Hmm.
Yeah, I know I never had to be honest with you. I never had a great desire to get into the infrared sauna business, but I was a bit of an adrenaline junkie. I was on the Whistler Ski Patrol mountain rescue team, pretty active, and I was also a firefighter. And all of a sudden, you know, I had difficulty walking, couldn't hold on to a telephone, difficulty writing. And they said I had fibromyalgia. And I'll be honest with you, that was pretty mainstream. And so I kind of went along with the label, and I view it as a label. And, they gave me, different things, NSAIDs, natural steroidal anti-inflammatories, and then I had gastric bleeding with that. And, so I was going down the rabbit hole. And what saved me was another fellow it doesn't sound very nice for the other fellow, another fellow in my four-man crew came down with the same symptoms about 6 months later. And I go, wait a minute, you got two healthy guys and neither of us can work. So I had an adipose tissue sample sent to a lab in the States called Aftercare labs. And it turned out I was very high in a chlorinated pesticide used in treating wood products. And I was high in both mercury and lead. And it wouldn't be fair to say all I did was the infrared sauna to get better. I changed my diet. I worked on my stage 4 sleep. I did a bunch of things that you're very familiar with. But of all the things that I did, it was the most effective in lowering my toxic load, reducing my pain level, allowed me to get back to work. So I got very passionate about the saunas. And it's kind of, it's been interesting because a lot of things have evolved in the infrared sauna market and from where it was kind of 20 years ago. 20 years ago, you're kind of educating people about infrared saunas, and now you're explaining some of the differences of the saunas out there. It's interesting with the infrared sauna. Sometimes people say, well, is that like microwaving your body? And is there a hazard with that? And you say, well, something far infrared is something we're exposed to naturally. When you're feeling heat or radiant energy coming off somebody else, that's far infrared. Your body peaks about 9.4 microns. If you lay on the sand and the beach in the summertime, that's far infrared. So it's something that we're naturally exposed to. As far as I can't really get into any of the health claims regarding infrared saunas because I have some kind of restrictions regarding Health Canada, but that's just the way it is. But I'd be happy to talk about what you should look for in infrared sauna, or some other questions if you have for me, Nick.
Definitely. Well, I mean, it's always so fascinating to hear someone's story, and we always talk about a pain to purpose to a promise, and moving through an illness, and I mean, you were a high functioning individual, had all this exposure to various different chemicals in the field of work that you're in, and who knows where all the different exposures to lead, mercury, and some of those other things that came in. And unfortunately, this is the reality of the world that we live in this day and age, is that we're surrounded by it. And so it's not just about, doing the right diet, doing the right exercise, which you were doing very regularly, as so many of us are. This is really about we call it going upstream, finding the root cause reasons for why we're not feeling well. And so you found, like you said, it's not the only tool you used, but it was a very powerful one. So why did you decide to go from that into making them? And why did you think that making them was so important, based on some of the other saunas that you'd seen out there?
At the time, 20 years ago, infrared saunas was 21 years ago, about infrared saunas were pretty new. I was using a conventional sauna. Then I discovered the infrared and I switched over. My initial interest actually wasn't into promoting them, selling them. I was looking for places to set them up in the Lower Mainland and Vancouver Island, where if someone couldn't afford to buy one, at least they could go to use it. That was my intent. And then things kind of evolved, right? And I was setting them up at different clinics and practitioners. Because I was at the time I was back to work in the fire service. And then things kind of, there was much more kind of interest in it. What bothered me on the market is there was a little bit of, I guess I would use the term a little bit of deception out there and kind of marketing kind of stuff. And I was very concerned with a bunch of things with the saunas. Many of them were very high in EMF, electromagnetic fields or electric fields. Many of them were high in VOCs, stands for volatile organic compounds. And so, and I just out of curiosity, I purchased 3 of the saunas out there. I won't mention the names, but cheaper saunas. And just to figure out what was going on in the industry. And to look at it, it was real wood on the outside, but 2 of us took a crowbar and we pried off the wood, and 2 of them were using MDF board, multiple density fiber board as a frame. The other was using plywood, of course, off gas formaldehyde and other things. So I was very concerned about that, because there's a lot of people where their toxic load is high, and so it just doesn't make sense to add to it, right? Mm-hmm. And then the ones that were stating they were low in EMF or electromagnetic fields, if you actually took a good trifield Gauss meter, it was off the chart. So they're going with the, I guess, assumption that a lot of people don't have good Gauss meters or whatever. So to me, if you're in an environment that you're using, these different benefits, you don't want to be sitting in a toxic environment, and you don't want to be sitting in a high electromagnetic field. There's research, more research in Europe than here, but there's definitely research out there. I partnered with an American company to build the saunas to my specs, meaning really low EMF, and EMF levels. Swedish standards or TCO standards about 2 milligauss or less, but at point of body contact. But of course, I wanted to get it as close to 0 as possible. So ours would average 0.2 milligauss, 0.3 milligauss at point of body contact. And so, and some people are more sensitive to EMF than others, but I don't think for any of us, it does us any good to be in a strong electromagnetic field. I had a gentleman the other day said, well, what's the big deal? We're all exposed to EMF. And I said, yeah, that's true. But I asked him if he owned a microwave, and he did. I didn't talk about that I didn't think a microwave was the smartest thing. I just asked him if he owned a microwave. And he said, yeah. And I said, well, if you took a Gauss meter within a couple of inches of it, it measured about 30 milligauss. And I said, but if you back off 2 feet, it drops down to 0. It's very effective by distance. And he said, okay, that's okay. And I said, would you feel comfortable about standing next to your microwave within a couple of inches for 30 minutes every other day? And he said, no. And I said, why not? He said, well, just to be on the safe side. I said, aha. And I said, so what's the difference in infrared sauna? You're sitting within probably inch and a half of the heaters. You don't have the luxury of backing off 2 feet. And then he goes, okay, I get it. I had to use that analogy for him to get the concept, Mm-hmm. So there's, as well as EMF, electromagnetic fields, there's something called EF, electrical fields, which is measured in volts per meter. So the ideal is to have low levels of both. So there's a bunch of research out there, and to me it's prudent to have the levels as low as possible. If someone's looking for an infrared sauna and they talk to, let's say, a distributor, manufacturer, any of the above, just ask them to send you the testing. And then when they get the testing, look at it closely to say, did they actually test the sauna at point of body contact, or are they just testing the heaters in isolation? Because the negative thing with the heaters in isolation is you're not including your electrical connection and wiring. And what you and I care about is the environment we're sitting in, not what the heaters test themselves. Mm-hmm. It's the same for the VOC testing. Make sure a brand new sauna is tested by an independent lab. Not bottles of air that are being sent to some lab tested by employees. You want, it's not that expensive to do the testing. It's maybe $1,500, $2,000. So that's the things to look for. So I think if the consumer can have the questions to ask, what I'm hoping that it'll do is it'll clean up the environment a bit, meaning some of these companies that are selling stuff that, a little sleight of hand kind of stuff, it'll push them to be more accountable, and then to be more saunas out there that are safe to use.
Mm-hmm. And ultimately you would think that would be the hope and the goal for every company, is to be more ethically aligned and delivering a good product, because obviously that's just good business. So it's extremely helpful to know what to look for when you're purchasing a piece of equipment, especially if you're going to spend, $1,000 or more. I mean, this is an expensive, relatively expensive or inexpensive compared to some of the technology that's out there, but it is a tool that requires a bit of an investment. So you want to make sure if you're going to spend that money, you got to make sure that you're spending on a quality product that you're going to use for the rest of your life, or, you know, for as long as it lasts. So that's extremely important. It's important to understand that if you're going to heat your body up in an environment that has all the VOCs, the electrical fields and things like that, this could just add more toxic burden to your body. So very, very important that we find a way to decrease that as well. So now, you said that when you went through this experience and you had these higher levels because you tested within yourself, what kind of effect did you see? Obviously you went back to work and a lot of the symptoms you had disappeared. What kind of effect as far as a timeline did you notice? And what were some of the testing levels that you saw afterwards? Like, were these things completely gone? Like, what did that look like?
Yeah, it's a good question. Well, I was going to, it's interesting, I was going to a mainstream rheumatologist at the time. I won't mention her name, but at UBC, and giving me the label of fibromyalgia, okay? And it was fascinating because I kept going, looking at research papers, there wasn't the same sort of internet access then, you know, kind of 20, 30 years ago. And this happened in 1990. So, and I would bring her these research papers and I said, look, the signs and symptoms of this toxin exposure are virtually the same as, you know, fibromyalgia or chronic fatigue syndrome. And there's an overlap. That doesn't mean everybody with fibromyalgia and chronic fatigue syndrome has a toxin problem, but there's definitely a subset that do, from my perspective. Anyway, so I'd bring her this stuff. So she was monitoring as I was going through the sauna protocol, and she was concerned. And eventually she said, it was quite fascinating. She says, you know, Randy, she says, you no longer qualify for fibromyalgia. She says, I can't treat you anymore. She says, there wasn't that many people trained in functional medicine at that time. And it's too bad, because she was, you know, a bright, you know, kind of young doctor. But she just said, I've never had any training on this. If I was you, I'd keep doing what you're doing, you know? And I still had, for a while there, as I recovered, went back to work, I still had some chemical sensitivities. And so, you know, it was the guys at the fire hall were great. They, you know, wouldn't allow anybody to have Bounce, aftershave, perfume, any petroleum-based products, and they were great that way. So that was good. And then over time, then that also got less and less. But I would say it took probably a good, I'd say, 8 months of doing the sauna where I really started to notice a dramatic difference. And then, you know, eventually I went back hiking and skiing and all these things. But it was a slow progress. I think often when you're in that position and you're going down that rabbit hole, it takes, you know, even if you change your diet and you detoxify and you know, do meditation and all these different things to improve your situation, it's not going to happen overnight. And I think that's the tough thing, is that people, sometimes they're looking for the quick answers. They're looking for that magic pill or bullet or whatever. And it's a lot of work. But if you put the same discipline in, you will recover. You know, it's the line that I always used to like. It's, well, because you'd have number setbacks. It's just nice when the light at the end of the tunnel no longer belongs to a train, because, you know, you get bam, and then, you know, because you're wanting to get your life back how you had before, and you want it to happen faster. And so it's the same as when someone's using a sauna. If someone's quite toxic, I'll say, go slow. Like, don't start off doing the sauna daily. You know, you might do it every 3 days, and you might do that for 3 or 4 weeks, and then every other day for 3 or 4 weeks, or even longer, and then daily. You know, so that's the thing. It's because you're mobilizing a lot of your toxins and heavy metals to your skin, but your liver is already having to deal with it. And if they have compromised phase 2 detox pathways, of course, it makes it worse. So if they go a little bit slower, they'll have way better success. And the other thing, if anybody has any sort of intestinal dysbiosis, they have a malabsorption problem, so they may be already low in electrolytes and trace minerals. So you really have to make a concerted effort to increase your electrolytes and trace minerals, and I'm sure you can speak on that. You know?
Well, it's amazing, Randy. I mean, you labeled off so many important nuggets for people to pay attention to, and I love that the first how you started this off is that you got fired from your doctor, not because she didn't like you, but because
she was lovely. She was lovely.
Yeah, because you went on beyond what she could have done for you, and that's what a wonderful feeling that is. First of all, to know that you're doing the right thing, you're being monitored, you're being tracked, and then you're being let go because you've obviously you're going in the right direction. And then secondly, you talked about this just sort of evolution of the symptoms and the evolution of the healing process, which does take time. And it's not like you just bioaccumulate all these toxins, in 1 week. Like, this is a building effect that we talk about, the toxic bucket. Over time, it's eventually overflows and symptoms start to appear because your body can no longer compensate for this overwhelm. And so helping people understand that this is a journey, and it's not about hitting the gas pedal to the floor. It's about slowly opening yourself up to this process of detoxification, elimination. And essentially, you're just improving your whole body's mechanism for elimination. So, help people understand how, like, because we know toxins are stored in fat, help people understand how this stuff gets to your skin. I mean, it should make sense to most of us, but maybe some people don't understand that the detox can happen, and it's not just happening through your skin. What does the heat do inside the body to all the different glandular systems and organs?
Yeah, the problem, the tough thing for me here is even talking about detoxification for other people. Unfortunately, I've been instructed by Health Canada that I can't make any health claims. I can tell my personal story, but I can't, unfortunately, say, hey, the sauna does this, the sauna does that. It's unfortunate, but that's I've been a little bit handcuffed lately, and it's been a little frustrating. But I have to toe the line, or I'll be shut down. So,
well, and that's just it. I mean, understanding that everyone's going to have a different experience, and there are certain physiological changes that happen by exposing yourself to heat. And so one of those molecules is called heat shock protein, right? Yeah. So can you speak a little bit about heat shock protein?
Yeah, there's Dr. Patrick Ronda has done some kind of good stuff on that. It's fascinating. It's now, to be fair, most of the studies on heat shock proteins are done on conventional saunas. Okay, but again, it's a similar thing where you're raising your core temperature. It's interesting. I used to sell the saunas to people that had chronic health problems before, and now I'm selling just as many to personal trainers and things like that, because they're seeing some of the physiological, kind of benefits. And I realize it's like as I'm talking to you, I'm feeling this is like a slippery slope here regarding health can, right? So, and it's kind of, it's like I said, you don't, when organization threatens to shut you down, you have to be cognizant of that. You have to watch what you say. And so I get people on the phone, they'll say, well, I have this condition, they can help you. And I'm just say, sorry, I can't comment, right?
Yeah.
It's too bad. But no, it's kind of, there's, as far as conventional sauna use, let's just talk about conventional sauna use. There's a Finnish study out there. There's a couple of ones, okay? And they took conventional saunas. And okay, so now I'm not making any claims regarding my infrared saunas, okay? So they took conventional saunas, and it's a good database. They took 2,300 middle-aged men over a 20-year period. That's a good database. Guys are mostly between 40 and 60 years old. They averaged using the sauna for about 14 minutes, because the conventional sauna is a lot hotter. Our infrared sauna is, between 110 maybe to 149 degrees is the range that people are using it. Conventional saunas in Fahrenheit is 180 to 210. So I guess I should talk Celsius. We're in Canada. Most people are getting in at 46, that may be getting out at 65 degrees. So, and a conventional sauna is a lot hotter. So in this study, they were only going in for they averaged 14 minutes going in. And they found the ones that use the sauna 1 time a week versus 2 or 3 times versus 4 times or more a week. And what shocked me is they looked at heart disease, stroke, cancer, just kind of go down the list. And so overall, we'll call it overall mortality, it reduced it by 40% if a person uses sauna 4 times a week or more. That's unheard of. If someone told you the drug or there was a supplement you could take that would reduce your mortality or increase your longevity by that much, you go, wow, where do I sign up? And it didn't even really hit the news. So that's what was shocking to me. Now, I was curious in the study, because I was a biologist before I was a firefighter, so I never minded doing research. And I thought, what's fascinating in the study, they're just looking at a person doing 1 time a week versus 4 times a week. And I thought, well, why wouldn't, to me, the control should be 0 times, right? Well, it turned out on these 2,300 middle-aged men, they could only find 8 individuals in Finland that didn't use the sauna at all, right? Of the database. So that's why they're comparing it once a week, and it just cracked me up, right? So
well, it's so normal over there. I mean,
yeah,
right? It's part of life.
yeah. And someone said, well, it's because the Finns were in better shape, and and I said, well, and they said, no, actually, there was alcohol involved. Sometimes there's overweight. There was a whole mix. It had anything to do. It just had to do with the sauna use. So that part intrigued me.
And that's amazing. I mean, that's data on just regular saunas. So what's the hype about infrared? Like why do infrared? And maybe we can also talk. Sorry. Go ahead. I was just going to say, along with that question, I was hoping that you could also speak on, there's different types of infrared. There's far infrared, near infrared, and full spectrum. And so if you can sort of tie all those together.
So I'll tie that in. Thanks. Sorry, I didn't mean to cut you off.
Oh, that's good. He's a passionate guy, everyone.
Yeah, I'll have to watch that. So with the infrared is different than conventional saunas because it's much lower temperature. People can handle it a lot easier. They can stay in there a lot longer. Okay. So without making any health claims, you can be in there 30, 40 minutes. You just have to watch your electrolytes. But except for that, it's much more comfortable, and you sweat profusely because infrared penetrates about 1.5 inches, maybe 1.5 to 2 inches into the tissue. So it's actually heating up the core temperature. And, as people have asked about contraindications from that, but it's not like microwaving your body. It's something that we're all exposed to. The big thing is, it's interesting, you don't come out feeling wiped out, okay? So like you couldn't I'm not saying you couldn't, but you wouldn't ordinarily do a conventional sauna, have a shower and go to work. You'd be kind of wiped out. Here you can easily do that in an infrared sauna. So it's very different. I like the far infrared saunas. It's in a little bit of the longer wavelength. There's some sauna companies out there that are near infrared, full spectrum. The idea with the full spectrum, you have near, middle, and far infrared. That's the theory behind it, or I would use the term, maybe the marketing behind it. The research on near infrared is really good. Okay, if you go into PubMed and Medline, there's good research papers on light emitting diodes and lasers. There's different devices out on the market now, some in the red range, some in the near infrared range, usually in that 630 to 940 nanometers. And the research is good. It shows in that range, it shows mitochondria function improvement, wound healing, tissue repair, all legitimate research. But the research papers were done on light emitting diodes and lasers. They weren't done on infrared saunas. And there's a big reason for that. It's not just the frequency intensity of the source. It's that there's something called the inverse square law from a light source. And you think, well, what is that? Well, if you're 1 inch away from a light source, or you're 6 inches away, if you're 6 inches away, you go 6 times 6 is 36, and you put a 1 over top, you're only getting 1/36 the intensity. If you're 10 inches away, you're only getting 1/100 the intensity. So that's why in all the research papers that I could find, they were either touching the petri dish or touching the skin or very close to it. So that's why even if you're using some sort of, whether it's an LED light or red light therapy or something, you should be as close to possible to it, because the inverse square law from a light source. It's not. So that's why, to me, if you have an infrared sauna and it's full spectrum, you got some light somewhere, where you'd have to ask the question, how far away from the body are you? What frequency are they in? Are they in the 630 to 940 range? And what's the intensity? So there's all sorts of variables. And it doesn't heat up the body the same as far infrared. So to me, I would use a far infrared sauna. If you want to do red light therapy, use that as a separate modality, and because there are some benefits of it. But I don't think I can get in trouble from Health Canada with that, because I'm not selling that product. So
yeah. And that's the protocol that we use in our clinic. I mean, we've got the photobiomodulation with the red light therapy and the near infrared. But they're two different therapies, and like you said, it's about the distance to that wave, and far infrared is working on that heat stimulation within the body. I know this has nothing to do with your sauna. This is something that we've invested in the past part of our clinic, and they're called infrared biomats. And there was some really interesting information looking at thermography. Again, this isn't Health Canada approved or any study approved, but it does show the thermodynamic effect of getting infrared inside the body and the core temperature rising. You can see on thermography scans. So it's definitely heating the body up in a deep way. That's amazing. So now let's talk about just some of the basic things. You get in, for those that are sort of, somewhat familiar with saunas and maybe not, you go in the sauna, it's going to dehydrate you. What are some like just basic things that you should be doing when using any type of sauna?
Yeah. Big thing is, the good news is, let's say you're sweating, which is great. And I don't think I can get criticized for saying you're sweating. But okay, so let's say you're sweating profusely. It's no different than a long distance runner, but they would suggest they consume Gatorade or something like that. I wouldn't say they, but some people do. And of course, it's got a bunch of crap in there. So I would stay away from the artificial sweeteners. I'd stay away from any sort of sweetener. So it's really important to replace your electrolytes and trace minerals. So you can do that a bunch of different ways. You can, I'm sure you'd be aware of some sort of electrolyte mixes. You're being more knowledgeable about that than I am. I sometimes chew on dulse. It's a seaweed. It's an acquired taste. You either like it or you hate it, but I don't mind it. I also drink coconut water. The only thing with most of the electrolyte mixes on the market, I find, Nick, they're a little bit low in magnesium, or they don't have magnesium at all. So the two ways, you can either take oral magnesium, or you can do it as a transdermal magnesium. It goes on as an oil or a cream. I would try a small patch on your leg first, because sometimes people get a rash. The big thing is with the electrolytes, I didn't realize the correlation between that and sweating. And I'm well acclimatized to using a sauna. And one day I was doing long sessions, and was probably, I don't know, 40 minutes that day, drinking lots of water, and I stopped sweating. I thought, wow, what the heck is going on? And I'm overheating. And so just something came to my head. I wonder if I'm low on electrolytes and trace minerals. So I went out of the sauna, I grabbed a handful of dulse, this seaweed that I talked about, and started chewing the dulse back in the sauna. Not right away, but within about, 7 minutes, I was sweating profusely again. So I phoned one of the doctors I really respect on his knowledge regarding the sauna use. And I said, does your body as a defensive mechanism, if you're low on electrolytes and trace minerals, does it minimize your sweating? And he said, oh yeah, definitely. So that was a really interesting correlation for me. So sometimes people say to me, I have difficulty sweating, and that's the first thing that I'll tell them to do, is increase your electrolytes and trace minerals. The other thing, information came from a woman called herself a sauna technician in Germany. I didn't even know there was such a position, but she says, yes, I was a sauna technician. Oh, okay. This had nothing to do with infrared saunas, just conventional saunas. They said occasionally they have trouble with someone sweating, and even increasing electrolytes. And she says what they do is they sit in a chair and they put their feet into quite a warm basin of water for about 5 minutes. Not so hot you're going to burn your feet, just kind of warm basin of water. Then dry your feet off, go in the sauna, and you'll sweat in half the time. And I always stuck in the back of my mind. And I was talking to a doctor in Toronto, and he says patients love his saunas, but his wife always has difficulty sweating. And I said, Peter, why don't you try this, right? Because what do you got to lose, right? And he phones me a couple of weeks later, and he says, Randy, it worked fantastic. I only had to do about 3 times, and she was got into this whole sweating regime. So yeah, it was kind of, and I don't know if it's because of the vasodilation or the reflexology points, but for some reason it seems to work. So that in your bag of tricks, I'm not saying most people don't have to do this, but if your bag of tricks, you might want to try that. The big thing is not to start off to do too much too soon. If you think you're have some chronic health problems, just start off slow and you'll have way better success.
Yeah, that's awesome. And what about aftercare? So you're in the sauna, you've been there for 20 minutes, 40 minutes, whatever it is. How quickly do you need to towel off? Like, let's say things are getting out of your body, fat soluble or water soluble or whatever. Like, is it okay to just not towel off, not take a shower? What's a typical recommendation? And this could be for any types of sauna again.
Yeah, there's kind of mixed answers out there, because I've heard that. But I would say the better answer is to dry yourself off, shower as soon as you can. If there's not shower facilities where you're going there, then still dry yourself off, and then go as soon as you can to a place where you can shower. Mainly because I'm being concerned about the reuptake of if you have something on the top of your skin. And it's never underestimate kind of, the fact that, stuff can be absorbed through the skin. I mean, that now they have drugs that you put patches on that goes through your skin. So I would shower soon after. If you can, if not, then towel yourself off, right? It takes you doing the sauna later in the evening. don't do it too close to bedtime because it heats your core temperature and it'll take you a little bit longer to settle down to go to heat seat. So some people have asked me, and I said, well, just I can't make the correlation between the health claim here, but don't do it just before you go to sleep. Do it sometime before that, and let your core temperature go down.
Mm-hmm. Yeah, it's been well understood, I think, from a lot of different pieces of information on sleep, and that lowering core temperatures is part of getting to that deeper stage of sleep. So that's a really good piece of advice, is to maybe do it earlier in the day, find a way to clean yourself off quickly.
Quite a bit early in the evening, and then you'll still have enough time for it to get down. Right? Yeah.
Well, I mean, I can't help but think, we live in very temperature controlled environments, and we would have, evolved over many, obviously for many thousands of years, living in harsher climates and being more adaptable by going through different temperature extremes. We know, I'm sure you're aware of Wim Hof and the Iceman and the cold water therapy and some of the insane and amazing things that humans are capable of by varying temperature. And I mean, it's one of the core things that we teach in our clinic is adaptation through fasting, through temperature variation, like saunas or cold or hot or whatever, through exercise, through breath work, through meditation. That's a pause in the busyness of daily life. Can you speak a little bit to, in your own life, what does that mean to you? Like, why do you think varying temperatures is important?
Well, just, as you pointed out, there's different benefits as far as, it's regarding you can have the contrast. You can go from the heat to the cold, back to the heat again. You can finish off with the cold. There's different stuff on. I have to be careful here because I'll start making claims again, right?
I'm just talking about in your personal experience. Why you like it?
Yeah. Because and to be fair, I used to do more of it. You go in the sauna and man, it'd be a cold shower, and then I'd go back in and whatever. And it was. I found it very effective. Mm-hmm. And, it's not for everyone. So you will still be benefiting, enjoying the sauna without doing that, but it's something that you can add to your regime. And let's go back to the Finns again. They would often jump into ice water, cold water, or whatever. When I was on the ski patrol at Worcester, we'd go in a conventional sauna and we'd roll around in the snow, right? And I don't know what the neighbors thought of that, but that was in the 70s. Okay, so.
Well, it's funny. I mean, I don't know what it is about just us as humans. There's something like mesmerizing about being super hot and then jumping in the snow. I remember as a kid going to my friend's cabin up in the Okanagan, and we would sit in the sauna and get burn yourself, basically jump in the snow, burn yourself in the snow, and then come back and just burn. I mean, shock your body in the snow and then come back and you feel that heat again. It's so like ingrained in who we are to have to go through these temperature changes, and I think it's playful, it's fun, and it's interesting to just feel the adaptation that your body goes through in these temperature exchanges. It's kind of you'd be amazed sometimes what you can do, as far as the two temperature extremes and just the effect it has on your body. Mm-hmm. Well, I did an experiment last year, the year before, where every day throughout our Canadian winters and summer, I did a cold shower, and I'd try to stay in there for about 3 to 4 minutes. We had not yet at this point had the sauna, which we are going to get very soon, as we talked about before getting on this call. But this is something that I'm very interested in, not only for our own family, but also for teaching our clients, because there's something really interesting that happens when you're in a space where you're feeling a little uncomfortable. Like I truly feel like putting yourself into different temperature exchanges does something to the mind. And I don't know if maybe even from your own personal experience, that sense of resiliency that comes from
there's different theories as far as why it works. People that have done it on a regular basis talk about the benefits of it. It's kind of like I said, I'd probably prefer not to talk about what I've read as far as the health benefits of this, because then I'm saying the health benefits of the sauna, right? Mm-hmm. But no, it's something that I think it's definitely worthwhile for everybody to try to do, and you might be pleasantly surprised the response it has. on your body, right? I think it's interesting. You think, okay, is it a physiological response? Is it a mental, or is it a combination of the two? I mean, there's all kinds of, that goes along with meditation and things like that, and breath work. Has that effect on your body, right?
Well, and we can all, I think, attest the fact of what happens when we exercise, even just, moving the circulatory system more effectively around the body. I mean, most people feel really good after they're doing that. And I know every time I've done a sauna or contrast hydrotherapy or cold therapy, this good feeling starts to arise within the body. So I do feel like it goes beyond just this physical type experience.
Yeah. And it's kind of, and you will, when you go in the sauna, you will find you will raise your heart rate. I mean, that's not, I don't think I don't think they can be critical of that claim, but anyway.
I'm curious. So let's say someone's starting off, they do once a week. Would you say maybe start with 20 minutes, 30 minutes once a week, and then slowly build from there?
Most healthy people can start off with 30-minute sessions, where you might start off a lower temperature. For instance, if it was a child, definitely the core temperature raises faster. I would limit the temperature, and I'll limit the time in there. Okay, and just keep an eye on them. If someone has contraindication, if someone is pregnant, there's not a study about infrared saunas and pregnancy, but there's one to do with, I think, hot tub use and greater chance of miscarriage. So be prudent if you're using the sauna not to do it when you're pregnant. I also wouldn't use it if a woman's breastfeeding. Much as it promotes the milk flow. I talked to a toxicologist at UBC, because I was getting a bit of feedback, and she said, oh yeah, you're definitely mobilizing toxins in the breast milk. So, I don't have any, there's not some research saying, hey, here's a study on such and such, but from advice from a toxicologist, she would say I wouldn't do it. Mm-hmm. And low blood pressure because of the vasodilation, I would just, I would keep an eye on somebody if they have low blood pressure. A lot of people have low blood pressure. They've never had a problem, but just it would be prudent to do that. But other health conditions, you always say, please check with your doctor first. She's but it's, I think the sauna can be used by many people, and it's, I think I've lost what question you were asking me.
Oh, well, it was basically just in regards to like building up to a frequency. And, but you threw in some contraindications, which is really important too.
Yeah. So building up, most healthy people can start off using the sauna daily. As long as you increase your electrolytes and make sure about the magnesium, it's really not an issue. You'll know quickly with the magnesium because you're going to start getting leg cramps and things like that. But magnesium is something we're mostly low in anyway. So you may make it worse by using the sauna if you don't supplement it. But no, I'm not a great fan of, there's certain conditions, for instance, that someone, I can't mention the condition here, how would I describe this? Certain conditions where someone might say, well, you're better off doing 10 minutes in the sauna or 12 minutes, and you slowly work up that way. And when I talk to the people, they're getting major Herxheimer reactions, headache, flu-like symptoms. And now my theory with this is you're mobilizing stuff out through your skin, okay? And but if you're not sweating, you're not mobilizing anything out through the skin. Okay, and so then your liver's having to deal with it. If you already have compromised phase 2 detox pathways, it makes it worse. So if you stay in there a little bit longer and just don't do the sauna as often, like every 3 days, do that instead, you'll have way better success.
Yeah, that makes sense. I mean, it's like, you've activated something. Now let's find a way to let your body eliminate it, and that happens through our sweat, which is a very normal process of getting rid of things, much like urination or bowel movements. Sweat is another mechanism for doing that, so that's very helpful. Is there anything else that you think that people may need to be aware of, or different?
Well, the advantage, one thing that the people I should probably explain, with an infrared sauna, it just plugs into a normal outlet in your wall. The large units need a 20 amp circuit, to be fair, but the smaller one, the 1-person or the 2-person or the smaller corner unit, just plug into a normal 15 amp circuit. And so really, You don't need plumbing, you don't need special power. So that's why I think it's been so helpful for people, because they can just put them in different rooms in their house. It's not a big issue. It's not like conventional sauna where you have to have much more power and hot rocks and, you know, water and stuff. And so it's nice. It makes it a means that someone can use an infrared sauna. And it's been interesting, because sometimes I sell to people that are Scandinavian, whether it's Finnish or, you know, Swedes or Norwegian. And I thought they were going to really resist the idea, because they want the branches and the you know, whatever. and I'm not saying they all want branches, but I'm just saying, you know, that you hit them with the boughs and stuff like that.
Right.
And I'm making it sound like it's some wild technique, but it's not. And they put the water on the rocks and they get the steam. And I love conventional saunas, so that's not. But I thought I would get a lot of resistance. But the interesting thing is, they already realized they've been well versed to using a sauna, but they're not in a space where they can build a conventional sauna. And they're saying, and they love the infrared. So that was been interesting, because I went into that cautiously thinking, well, what would they think? And they can, well, we're so used to it, and now we can have the same sort of, I'll call it benefits, but using the infrared, right?
Mm-hmm. Yeah, maybe you can talk just about some of the different sizes. Like there's one person, and so you can get these things into small spaces.
Yeah, there's one person that's the outside dimensions would be 36 by 36. Two person is 40 by 48. This is inches. Okay, I know we're metric, but I'm still taught with inches there. I think as your typical Canadian, if you said so many centimeters, they say, well, yeah. Anyway, so then there's the larger ones you can actually lay down in. One's called the E3H. The outside dimensions on that would be 44 by 72 inches. But that one does, to be fair, that one does need a 20 amp circuit.
Mm-hmm.
You know, so it's kind of, it's not, I would, most the corner unit, you know, you can sometimes people like that because you're not sitting right beside a person, like on a city bus bench or at an angle. And so people do like that. But yeah, most of the time, I'd say the most common one is the two person, the corner unit, or if the people have more space, the E3H where they can lay down in it. Mm-hmm. And you have an option. Most of the time in the infrared sauna, I forgot to tell you a few other things to look for, is you want to have maximum surface area close to the body as possible. So when they first came out, I found a little bit cool below the waist, or that's the feedback I had from a practitioner. Everybody said it's great, because I used to have the ones with ceramic heaters, and I got a lot of complaints about the hot spots and cold spots. So I went to the carbon fiber. And so we looked at to say, what could we do to address that? Because it was a little bit cool below the waist. So we put a heater underneath the bench itself. We pushed the side heaters in front of the bench and down to the floor. And front of the bench is about 10 inches towards the front wall. And we put, on the larger units, we put additional heaters at the front wall, and we put a heater in the floor. The only concern what they had with the heater in the floor, I didn't want it to be exposed to the sweat and then off gas. So we put a ceramic tile over top of the heater in the floor. So that kind of, so a few things to look for if someone's looking for an infrared sauna is to see where is the coverage of the heaters. You want as much as possible against your body, you know, and it's, and so that, because the closer that is, the quicker you're going to sweat, right?
Mm-hmm. Yeah, that's fantastic.
Yeah.
Yeah, I mean, you went over a ton of stuff, things that we all need to pay attention to when looking for the right sauna, kind of what to expect and protocol to, you know, make sure you get your minerals, safety things, you know, because it is important. You know, some people might have a more challenging time than others and need to go at a slower pace, and that's you know, all extremely important. Anything else you think that the listeners may need to know?
No, athletes use it two different ways. Okay. I was talking to the gentleman head of the Calgary Olympics at the time, and they have one of our units in there. And it was interesting because the gentleman told me, he says, the athletes cheat. And I said, what do you mean they cheat? And he says, well, they go in there fully clothed for about 10 minutes. And so just before they start, 7 minutes, 10 minutes, just before they start to sweat, then they can go and do their intense workout without minimizing the warm-up time period. Then he says, then after they've been working out, they go back in the sauna and they do stretching inside the sauna itself and stretching after they come out of the sauna. He said they can increase their range of motion by about 15%. He said that may not mean a lot to you, but he said Olympic athlete, he said that's huge. So I was quite intrigued with that. Again, it's the whole effect of heat on the body. You just to be fair, you have to be careful not to overstretch because you don't have that limitation. So you just have to watch that. But yeah, no, that's been really interesting to see as well.
Mm-hmm. Yeah, that's a fun little thing. I mean, I'm going to try that on the one that I've got, because I know I'd like to increase my flexibility as well,
Yeah.
and using a protocol to, you know, get yourself ready for movement, and then you know, since you've activated the cardiovascular system through your exercise, great way to just finish it off with a sauna. And I think, to your point before, that's probably why we are seeing a lot more of these saunas show up in gyms and things like that, because I mean, the two just go so hand in hand.
Yeah.
Yeah.
Oh, that's great. But yeah, I'm sure after there'll be something I think, oh, I forgot to bring this, but I think we right.
Yeah, well, if we need to, we'll just do another short one on
no,
specifics.
I don't think we'll need to, but yeah, no, it's great. I appreciate you having me on, you know.
Yeah, thanks so much for sharing your wisdom. And you know, you're a locally based company, which is fantastic. You guys, where's your facility?
It's I have a warehouse actually in Delta.
Mm-hmm.
Most of my employees are in Vancouver. I hate to admit it, but I've recently moved to Victoria. So.
Oh yeah, okay. Well, it's still in BC, and you're not that far away. But yeah, that's another one of the reasons why, you know, we wanted to look into your sauna, because it was local as well, and you spent so much effort on, you know, clearing the EMF or decreasing to the smallest, you know, possible limit. And so yeah, we're really excited to have this in our space and have more people try it out.
Oh,
so
well, thanks very much. I sure appreciate being on.
Yeah, thank you so much,
Okay.
Randy.